Hey, Medicare scams are at an all-time high. You have probably succumbed to answering the phone and thinking it's possibly Medicare. If that has been a situation that you've ever experienced, I'm going to walk you through today exactly all the different scams. And then at the end, I'm going to walk you through a 20-second test that you need to know called the dollar drug doctor test that we teach people. It's a simple way to eliminate yourself from ever getting scammed ever again. So what's really happening with the calls, texts, emails that you're getting? Most of the time, these are third-party marketing organizations that actually generate Facebook ads that are clickbait ads that allow you to be able to click on something. Also, you get a phone call. Sometimes they're posing to be a Medicare health plan. Maybe they're calling and saying, hey, this is Cigna. I wanted to update you about your information about your Medicare health plan. So if you're on Cigna, there's a hook there that a lot of times attracts people to stay on the phone, and then they will say, oh, okay, I didn't know there was an update. And then they'll start guiding you into questions. And a lot of times in that, they're wanting to confirm information that you actually have to give them. So in confirmation of information, if you are called by your Medicare health plan provider, typically Medicare Advantage or prescription drug plan coverage, they're going to have your information. They're going to have your member ID number that's going to match your card. They're going to have possibly your social security number. They're going to have your MBI, your Medicare claim number, that 11-digit number that's on your red, white, and blue card. They're going to already have this information. You shouldn't have to be relaying the information back to them. So that's one thing to always keep in mind when you're getting solicited to. Or if someone's calling you and is legitimately the healthcare provider, I like to say a lot of times, give me a phone number. I want to call you back just to make and confirm that you're not a third-party marketing organization or a scam. You're not going to call them a TPO. That's what we call it in our industry. But you can just say, let me have a number and let me call you back. Once I have my information gathered, I'll give you a call back. And then you can look on the back of your card, your insurance card, and you actually can call the customer service and say, hey, somebody from Cigna or Humana or whatever your drug plan or Medicare Advantage plan is, just to confirm to make sure you're not getting taken care of. Now I'm going to walk you through some of the major things that are used as hooks for some of this scam. And one of the things is called the PHRB versus the SSBCI. So what is exactly those two acronyms? Well, it's basically the food cards that most people are not eligible for. So I'm going to break down exactly what those two things are and explaining in detail exactly what to be looking for and what to ask for. So what is PHRB? Well, that stands for the primarily health-related benefits, the short-term medical-related, like hospital stays, or you're released from a hospital, you go to a skilled nursing facility, and when you are released, Medicare Advantage plans a lot of times have a food benefit or a meal benefit up to so many days. Usually they're 5 days or 7 days with 14 meals that are provided in and through the Medicare health plan that you're on. So most Medicare Advantage plans now have that. That is related to PHRB. It has nothing to do with you being qualified. It just has to do with you enrolling into a Medicare Advantage plan that has a PHRB benefit. And you'll hear people say meals can be provided at no cost up to 7 days or 14 meals after post-discharge of a hospital stay or post-discharge of a skilled nursing facility stay. The second one that we're going to talk about is the SSBCI. This is a special supplemental benefit for the chronically ill. So this is actually new, and this is why a lot of you guys a lot of times are scammed into clicking on a Facebook ad or receiving a phone call and somebody's talking about your flex card benefit or your food card benefit or your food allowance that you actually can qualify for. Or a lot of times they'll say things like, hey, Mrs. Scott, this is Cigna, and we're calling in regards to your food card benefit that you qualify for based in your area. Are you aware of that information or aware of that benefit that you qualify for? So they'll use terms like if you qualify or that you're qualified for. I want to go over that information with you. Let me get a little bit of information real quick from you. And they'll ask for your name, date of birth, and some general information. And they'll kind of warm you up. And then they're going to position you to either A, transfer you into a licensed sales agent, and that person's going to get some information from you as well, and then begin to what I would call sell you on a benefit that may not even exist. So if you are clicking on a Facebook ad or an ad on Instagram or TikTok, or if you're picking the phone up or you're answering an email and it's dealing with this SSBCI, I'm going to walk you through exactly what this benefit means so you're not confused any longer and you're not clicking and getting scammed into changing plans when you will never have that coverage. So let's explain exactly what the SSBCI, the special supplemental benefit for the chronically ill, it's really a non-uniform benefit like groceries or food. It's offered only to members who meet plan-specific definitions or defined chronic conditions. So historically, in previous years, up until this year, and then going into 2026, people didn't have to qualify based on a chronic needs. And then the government came in and basically said, hey, these Medicare health plans are using this as a hook to bait people into enrolling. And the problem with that is people that were selling your information to call centers were calling saying, hey, you qualify for this, but they wouldn't verify to make sure your doctors, your specialists, your medications were in that plan. So they may take you from one Medicare Advantage plan into another Medicare Advantage plan because of the food benefit. Well, this SSBCI legislation actually rolled out to actually provide protection. So what it does is if you're chronically ill, you can qualify for special needs plans called chronic special needs plans, or some Medicare Advantage plans will allocate an allowance like $50 a month, or maybe $100 a month, or $30 a month, depending on your area, depending on the plans, will allocate money if you have a chronic condition. If you're diabetic, congestive heart failure, and there's typically 4 major chronic conditions. I'm not going to dive into those right now, but basically you have to qualify. Sometimes people will say, well, I qualify because I live in the area. Well, it's not based on where you live. It's based on your health conditions on the SSBCI. So when you are scammed into this, a lot of times you're thinking you're going to qualify. And what will happen is this person will start going through all the information about the benefits, about the plan. They're telling you about everything, and you're kind of hooked in with emotions. And then, sales are made when, we're piqued by our emotions, and then we justify it with logic. And I would say logically, if the plan is not going to be a good fit and you don't qualify for that benefit, then you shouldn't tie your emotions to that. I'm going to walk you through to eliminate that emotion to logic reasoning and explain to you exactly what to do so you're not scammed here in just a second. So one, before I explain how simple steps to eliminate yourself from getting scammed into this scenario or tying your emotions to something and then finding out at the end you don't qualify. A lot of times once they get you to the end, it's kind of standing over side of a mountain and somebody kind of pushing you off. It's very easy once you get to the edge of the mountain of making a decision for somebody to just kind of make you jump and make that decision. So I want to eliminate that. I want you to understand the SSBCI benefit actually is there to help stabilize a person that has chronic health conditions. Why the benefit is there is to help with better food choices, to providing vegetables, fruit, and certain meats into their diet to ensure that they're getting a healthy standard of living. Now, let's be real, $50 a month of this benefit in a plan is not going to change the dietary need of a person typically. So that's breaking it out to less than $15 a month or $15 a week. So that is not going to make a huge impact to me on health. So I think it's kind of it's a sad benefit to entice people to enroll into something when in reality, the benefit is made to be able to help create better health outcomes for a member that qualifies for that based on chronic needs. So in plain English, the takeaway is really if an ad implies everyone gets grocery cards or grocery benefits, it's misleading because everyone is not going to be qualifying for chronic needs. If you don't have chronic needs, then you're not going to qualify for that food benefit. I don't care who tells you that you do. You need to understand that by the new legislation and by the rule of what's written in the law now for Medicare, you're not going to qualify if you don't have a chronic needs. Now, with that, you need to be very aware of these 5 red flags that I'm going to cover with you here in just a second to eliminate you from stepping over and what I say, getting to the edge of the cliff and just jumping into something and then all of a sudden realizing the outcome is your doctors are not covered, your specialists are not covered, and really the medication costs on chronic special needs plans, historically they have been built over the last 2 years to have better medication costs, but I'm going to reveal a truth here in just a second that's going to make you kind of shocked that a lot of times it's not what has been advertised. So let's go over the 5 red flags. One, when someone uses a superlative that everyone qualifies for this benefit, that is a superlative that is an X through that. Not everyone qualifies. As I just said, not everyone has a chronic needs, and even if you do, doesn't mean the chronic needs plan is going to be best meet your need when it comes to medication costs, copay cost, access to care. I just talked to an agent that lives up and around Bristol, Tennessee, and he talked to a lot of his clients, and he was trying to put them on a chronic needs plan if it was the best fit. But what he found was the medication and formulary actually was higher than just keeping them on their standard Medicare Advantage prescription drug plan. So one, that's a red flag. If someone's telling you on an ad or communication by phone, or you're talking to a licensed agent thinking you're talking to somebody that's educated and knows what they're doing, and they begin to use superlatives like everyone's going to qualify or you qualify, until they ask you the questions of qualifying questions that allow you to know if you qualify, you don't qualify. So it's like getting a loan in the bank. If you have good credit, if you have, the qualifications for that bank, you're going to qualify for the loan. But when you walk in the door and you sit down with a loan officer and they say, hey, Mrs. Scott, we're going to get into this information here in just a second, but I want to let you know you qualify for any loan at our bank. That is a misguided statement, and you need to be very aware when people say that. Second thing is no doctor and drug check. Sadly, a lot of times in these conversations, when you're clicking on something, you're talking to somebody, they're not verifying your primary care, your specialist, and your medication. So if you're on a Medicare Advantage plan, we like to say doctors, medication, and then plan needs come next. So if your doctors are not covered and you have to access care to some doctor you don't know, you're going to be upset. But that is a red flag. Often if you're talking to somebody, and especially even if you're talking to a licensed professional, maybe you've called somebody and they're not asking you information. They're just wanting to jump into the benefits of the plan, the summary benefits or the benefits of the dental, hearing, and vision, and they're not verifying your doctor, your specialist, and your medication being on that plan. That's a huge red flag, and that's the second one. We're going to roll into the third one in just a second. Another big thing, if you click on something, right now there's a 48-hour cooling off period unless it is prior to the ending of the AEP season, which is December 7th. So if you have within so many hours of the close of the annual enrollment period every year, you don't have to have a scheduled appointment 48 hours out or a scope of appointment. Now, it is being proposed in 2027 that the scope of appointment is not going to have a 48-hour cooling off period. But if you click or you talk to somebody and they are trying to transition you to an agent, and that agent is going to go ahead and verify and get a scope of appointment that day, and then walk you through changing your plan on the same day and does not create a 48-hour cooling off period, they're breaking CMS guidelines. So you need to be aware that it's a pressure to enroll now as opposed to, hey, let me gather some information from you. I'm going to go over these benefits with you. I want to verify your doctors, your specialists, your medications. I'm going to walk you through how the plans work. And then maybe even going into the details of the plan and then deciding, yes, this is a good fit, great. Hey, I'm going to schedule a time 48 hours out to go over these details as far as the summary of benefits, make sure you understand how the plan works, and then we're going to walk you through the enrollment process at the end of that call. I have to, by CMS guidelines, wait 48 hours for a cooling off, except with the exception of at the end of the annual enrollment period that runs from October 15th to December 7th, we can go out 2 days and begin to enroll anyone and do an immediate scope of appointment. So that is the third red flag. And then the fourth one is what we call lead meal calls and transfers after you clicked on an online ad. The reality is your contact was likely sold multiple times. So when you click on something and you put your information in, now for us, we have information we advertise. You may get an advertisement that pops up on your social media feed. And if you click on Medicare Hub's ads and fill out a lead form, it's your first name, last name, email, and phone number typically. It comes into our office and a licensed professional typically is going to call you and you could say, hey, can I talk to Kelby? And you could actually talk to me. That person that's helping you, I may redirect them back to somebody here in the office, but you're actually going to talk to one of us that's a licensed professional. When you typically click on something and put information in, it's lead baiting, and they're going to sell your lead to multiple lead companies. Those lead companies take that information and sell it out to multiple agents. And thus, that's why your phone went from ringing one time to 20 times a day, because your information is being sold to lead factoring companies that are dispersing that out, and 10, 20, 30, 50 agents are calling you all at one time or texting you or emailing you. So don't be hooked into that red flag. And we're going to go over the fifth one to end the video here in just a second. So the fifth red flag, real quick, and when they say, hey, we're going to check your doctors and medications later, let me go over the plan information with you first. this plan is really, really awesome. It's got incredible dental, hearing, vision. They'll kind of deploy the facts of what is important to you to, again, going back to emotional tie down or emotional hooks in you. Like, hey, the dental is $3,000. You said you were very interested in dental. Well, great, dental's $3,000, but you can't access any care to the doctors of your choice, and medication is not covered correctly. That's going to be a no for us when we look at plan reviews. So you need to make sure that your doctors are being looked up. Also, all the plans are the same. Is another big statement, like all the plans are kind of the same, Mrs. Scott. Let me get your information, and it just leads you down into a rabbit trail trying to rapidly disenroll or rapidly enroll you into another plan and churning you into something that's going to end up causing you problems down the road. Now, by the numbers, that's the 5 big red flags you need to be attentive to when people are calling, when you're clicking on something. And honestly, guys, most of you guys don't want people calling you. You don't want tons of phone calls coming in. So be proactive, calling an agency like ours and scheduling times. We set up annual reviews for anybody that calls into the office. We can review now, and we can also schedule a time in October, November, or December of next year to schedule a review. And you actually build a relationship with an agency that you trust, that values you as a person, that has your information with doctors and medications and specialists and plan needs. Or if you're looking at Medicare supplements and rates, and you're trying to reduce rates or know if you're eligible to enroll into a Medicare supplement, or you have questions about prescription drug plan, work with an agency that knows what they're doing, that's licensed professionals, that has a staff and brick and mortar, and they're not a call center model. So that's call center models. You typically are dealing with people with 3 to 6 years or 3 to 6 months worth of experience a lot of times, and they're just neophytes. They're uneducated people who've been trained quickly and put in a call seat to answer and churn business. Beware of that. And then we're going to go into exactly what is this 20-second doctor drug dollar test and how you can use it to be able to save yourself from ever being scammed. So what is the doctor part of the doctor drug dollar test? The doctors are these the exact providers in network this year. So asking the question, are my doctors in network, my primary care, my specialist, yes or no? Get them to, one, they should be recording the call, and they should be communicating that the call is being recorded. It's a CMS guideline for us to be able to communicate that to you. If you call us, I'm going to say this call has to be recorded per CMS guidelines. We're going to tell you how many plans we offer in your area. And then also, if we can't help you, you can go out to Medicare's website or call Medicare directly. But you need to be able to make sure that, one, they're verifying your doctors. Second is, drugs are my exact medications and dosage covered by this formulary. And then what are the authorizations or prior authorizations that are needed, or step therapy needed for this drug that may not be on there or is on the formulary, but there's a prior authorization needed. You need to know what steps are going to happen when your plan changes if you so choose a plan. So that's the second thing, the doctor, the drugs, and then the dollar, the 3 Ds. The dollars, what's my total annual cost, premium plus copay cost plus max out of pocket? Like, what am I going to pay when I access care? And if you're on a Medicare Advantage plan, guess what? It's apples to apples. If you're not going to save any money changing your plans, and they're selling you on some benefits you don't qualify for, you shouldn't change. So you need to know exactly what it's going to cost you to go to the doctor, the specialist. If they're not going over that, and they're being very nebulous in the coverage and how the coverage works, and they're not going through what's called as a summary of benefits, they're not meeting the guidelines of the health plan to market that health plan, and they're going to scam you and end up screwing up something on your health care plan. So if you think you've ever been churned or misled, one, we've gone over a lot of ways to avoid that. But if you feel like you've been put on a plan, it's the end of the year and going into the first of the year, you're going to have an open enrollment period in January, February, and March every year. So if you're ever screwed up during the annual enrollment period, put on something that doesn't cover your doctors, your medications, your plan, your formulary, and things like that. You're going to have a window of time of 3 months to make a change. Also, with the huge regulations and changes over this year going into 2027 or 2026, we are seeing a lot of plans being taken off the market. 1.8 seniors are losing coverage going into 2026. If you've been affected by your plan coming out of the market or coming off the market, or you're unaware of whether or not your plan is going to be effective in 2026 or 2027, I would say reach out, call. We'd love to be able to walk you through. We're here to be able to make your life easy by making Medicare simple. Guys, you can call, schedule a time. Otherwise, we'll see you on the other side.